This video will be about ligaments, the important structures that allow for our skeleton, our bones, to move in a controlled fashion. Without ligaments, our skeleton could not move in the way it does. Not only do our ligaments have structural importance, they also play an integral part in the complex connection between our brains and our bodies. Ligaments are structures that help stabilize and guide motion. Conversely, any motion puts stress on our ligaments. Ligaments are the connections between bones. Joints are where our bones glide past each other and need something to connect them because with this motion comes inherent instability. Ligaments help provide stability. Ligaments as a structure are quite tough but flexible. They can resist tremendous forces, but allow for remarkable amounts of movement. Where ligaments are located and how many ligaments are present at a specific joint is determined by that joint's shape and function. Some joints, like the hip joint, have more built-in bone stability due to the nice ball and socket type of joint. However, other joints, like the shoulder, have much less bone support. To generalize the structure of a joint, you can think about a joint being a square with 4 sides: front, back, inside, outside. There will be 4 ligaments supporting the joint for each of those directions. Obviously, this is an oversimplification, but it is a good way to think about things to start. The knee has medial and lateral collateral ligaments, the inside and outside of the knee, and anterior and posterior cruciate ligaments on the inside. The collateral ligaments help prevent excessive side-to-side motion, whereas the cruciate ligaments prevent anterior and posterior sliding of the joint. These 4 ligaments do allow for guide the knee through bending and straightening that we associate with normal knee function. Other functions of ligaments include guiding and transferring forces that travel through the bones and joints. For example of this, see my video on perifractures and the bones in the forearm, the radius and ulna. They must work together to have proper motion of a forearm. Certain activities stress our joints and ligaments to the extremes, classically demonstrated in the elbow joint while throwing. This stress can be raised to a whole other level in combat sports such as mixed martial arts or Brazilian Jiu-Jitsu, when the goal of defeating your opponent is often accomplished by literally stressing joints through submission attacks. To say this differently, the joints are already stressed with hyperdynamic movements such as defending takedowns, but there are specific attacks on joints, submissions, with the goal of having your opponent give up or suffer real injury. Examples include arm bars, demonstrated by Ronda Rousey, footlocks and heel hooks by Dean Lister. The examples go on. Now, ligaments do more than just stabilize and guide joints with their structural properties. They also contain nerves that send information back to the central nervous system and brain, and are part of the complex reflexes that your body has to help protect yourself from injury. These nerves also help tell your brain where your body is. This is proprioception. Some people will even call this the 6th sense. As a small aside, proprioception is pretty darn cool. There is evidence that it can even help guide bone repair or remodeling. And that will have to wait for a whole other video. Let's get a little more detailed on the structure of ligaments. Ligaments are fibrous connective tissue, considered soft tissue, and do not show up on x-rays. They connect bone to bone, whereas tendon connects muscle to bone, but they're very similar. By weight, ligaments are mostly water.
Be formless, shapeless, like water.
Like many things in our body, but the rest is mostly something called collagen. collagen is a very important connective tissue throughout our whole body. Collagen is a series of proteins arranged into a structure that is flexible but firm. The structure under a microscope is of parallel waves that can straighten as the ligament is stretched out, but will return to its normal wavy appearance so long as it's not stretched out too much. Within the ligamentous structure, there are other cells, fibroblasts that can help make collagen and to repair damage. There are also nerves that we previously mentioned. A little bit about the stress-strain curve. We are not mechanical engineers, but it's worth talking a little bit about the failure of tissues. I touched on this a little bit with the bone video, but we'll go into it a little bit more detail here. Ligaments, due to their structure of waves or crimp that can straighten, the structure does not see significant tension until the waves are stretched out. As they stretch out, the structure starts giving more resistance to the stress. When they reach a point where the stress that they are subjected to exceeds their ability to stretch, they begin to deform. If the stress keeps going, then the ligaments fail, also known as rupture. Because the ligaments are soft tissues with a lot of water in them.
Now you put water into a cup, it becomes the cup. You put water into a bottle, it becomes the bottle. You put it in a teapot, it becomes the teapot.
They have special properties called viscoelastic properties. This means that the stress-strain curve is dependent on the time or speed the forces are applied.
Now water can flow or it can crash. Be water, my friend.
So what happens when ligaments fail? They fail when the forces applied to those ligaments exceed their ability to resist on the stress-strain curve we talked about. It can certainly be seen with a sudden force, such as a fall, but can also happen over sustained long periods of stress or with repetitive motions. If the forces on the joint are just right, then multiple ligaments can fail and the joint becomes very unstable. This can result in the joint actually shifting and becoming dislocated. When a ligament is injured, there will be an inflammatory process. You can see my video about inflammation. First, the nerves within the ligaments are activated, telling you to stop the mechanism of injury. Tap out. There will be pain and often a reflexive reaction. If the damage is significant, there will be bleeding. Sometimes you might even appreciate the new instability, a feeling the joint is floppy if the ligament is significantly torn. Soon, swelling and stiffness develop about the joint that was injured, which might help with the feeling of instability and gets you to at least stop moving it around. If there was a dislocation of the joint will not move correctly and may not even move at all. An orthopedic surgeon can often make the diagnosis of ligament injury by physical exam, but sometimes imaging such as X-ray or even MRI may be required. The best way to treat ligament tears depends on a lot of things: the specific ligament torn, the severity of the tear, and the health and goals of the individual patient. Many ligaments can heal well on their own with time and protection. Other ligaments, such as the ulnar collateral ligament of the thumb metacarpophalangeal joint, if torn in a certain way, require repair. Other ligaments, such as the anterior cruciate ligament of the knee, cannot even be repaired and have to be reconstructed, remade with new tissues. When ligaments heal, they heal with a scar. Ligaments can regain many of their previous properties, but they're never going to be normal. Strength and flexibility of the ligament at the scar will be impaired, but usually it has healed well enough to have normal function. As always, it is best to be evaluated by a specialist, not only to make the diagnosis, but to also create the best treatment plan for you. Our goal as orthopedic surgeons is to get people to their best function and limit risks. The decision of treatment often weighs the patient's preferences, their activity level, goals, and other health factors. In the end, we want you to be able to keep moving.